Chicago's #1 news, this is ABC 7 Eyewitness News at 11.
Welcome back, everybody. Taking your child to the dentist can be difficult, as you know, but it is, of course, necessary. And there are things every parent should do right now to make sure that trip is a lot less painful.
Dr. Ted Grellner is here to reveal 3 huge mistakes to avoid with your child's teeth. Welcome. Between the two of us, we have 6 children.
6 kids.
She carries the bulk of that burden. But isn't it obvious you should just tell your kids to brush their teeth, right?
Well, it's the biggest problem with sugar, in my mind. It's not so much how well they brush their teeth, although that's very important, obviously, but it's how do you manage sugar that's really the most important thing. That's part of what I wanted to present.
And that is very hard when it comes to little kids managing sugar. We'll talk more about that. So what are some of the biggest issues that you see?
Well, let me start with this.
Okay. Oh, props. Okay.
Tom Cruise would not be the star that he is today without his dazzling smile.
It's true.
Yeah.
Cameron Diaz's career path may have taken a very different turn if she hadn't taken care of her teeth.
I'm sure she would really appreciate that.
So that's why I'm here to present the 3 huge mistakes to avoid with your kids' teeth. The first huge mistake is to not manage their sugar intake properly. You know, how often they brush their teeth is not as important as how many minutes a day they have sugar in their mouths.
Okay.
The bacteria they're going to miss when they brush, and they're going to miss it, is going to turn sugar into acid that's going to eat away at the tooth surface underneath. The longer the sugar is available, the longer that acid can dissolve the tooth underneath, forming the holes that we call cavities. The problem is that the average American consumes 4 pounds of sugar every 8 days. It's insane. We can't sterilize our teeth, but what we can do is we can limit the sugars. We can starve the bacteria in our mouths by limiting our sugar intake.
And then deal with all the whining and complaining from the kids.
Exactly.
Does the sugar have to come in refined form, or does that include, fruit, refined carbohydrates?
Fruit's not so bad. But it's the refined sugar that's the biggest problem.
So then is there a trick? I mean, clearly kids are going to have sugar. So what's the solution to that? Brush your teeth right after?
You know what? That's a really good question, because I've spoken to 2 young mothers recently. They're brilliant. What they do, I just created a new rule, Dr. Ted's 3 T's. Treat treats as treats. They limit the treats they give their kids to weekends. They give them maybe 1 or 2 sugary treats as a special treat on the weekend. They don't get anything sugary during the week. If they're thirsty, they get water. They don't get fruit juice. They don't get chocolate milk. They limit the sugars in their kids' lives. And if they're not addicted to it, they can't be whining for it.
Yeah, that's a big thing in our family. Actually, we don't do fruit juice. It's water or milk.
Yeah.
And then you say that you have what you call wise words for parents.
I do. Water after sweets. To limit the cavity rate that you have to limit how much time sugars are in the mouth. Rinsing sweetness away with water really does help.
Okay.
I invest in care early. You know, that buck you save early on that you end up spending 20 times that later for a worsening problem that you can't put off, it not only hits your wallet, but it hurts your child.
Okay.
Yes, sweet recognition. If you want to manage sweets, you got to recognize them. You know, the fruit juice you give your child or the fruit roll-up that you give them, it's loaded with sugar. And, sleeping your child with a bottle of formula or milk, it will very quickly rot their teeth. So sugars are in many more things than we realize.
And E?
Electric toothbrush.
Okay.
It's really tough to clean our rounded teeth thoroughly, and kids have such an advantage when they can use something like this, a Sonicare for Kids, because they're so much more effective with it.
Yes.
Can I mention one other thing in terms of problems? One of the biggest problems I feel parents need to do is eliminate wisdom teeth early. These are actually 3D printed models of actual teeth. Removing a partially grown wisdom tooth from the soft bone of a 16-year-old is far easier and less risky than removing the fully formed wisdom tooth from the harder bone of a 20-year-old. Just 4 years difference.
Very good point.
It's
We're just talking about that.
Lesson. Just had one removed.
Thank you so much for coming in with those advice.
And just remember, you don't have to brush all your teeth. Just the ones you want to keep.
Just the ones you want to keep. Good advice.
Which is all of them. Okay, thank you. And Dr. Grellner has a lot more advice in his book. It is called 8 Secrets About Teeth Everyone Needs to Know. It is available on Amazon right now. And thank you so much for joining us.
My pleasure.
Love the tips.